This is my client who is going to describe the injury to her acromioclavicular joint, also called the AC. And of course, we also had to treat your first rib with that. So go ahead and tell us your story, please.
My name is Jennifer Hotz, and I had fallen off a ladder in 2020, and it ended up creating a lot of problems for my upper right side, especially my right clavicle, and for me, my right scapula, and for me to be able to move my shoulder and even use my arm. And at one point, I got to the point where I couldn't even use my right arm for about a period of 5 months. And so I'd been to many multiple doctors in different states, and just suffered a lot of pain that I had never felt before in my ribs, the scapula, the clavicle, and up the neck. And so I had done, I'm on my 8th physical therapist. And so I found that you really have to try to find the right physical therapist that can help you. And I have done physical therapy for about 3 years actually now. So when I started out, I was completely hunched over. My right side was pulled way more forward, and I had a large buffalo hump on the back of my neck. So I was able to get a lot better and more straight, and that hump on the back is less. But I got to a point with physical therapy where the clavicle just was not getting any better, no matter what I did.
So how did it limit you? How did it feel when you would lay on your stomach?
I could not lay on my stomach at all.
What would happen?
They tried to do a clavicle MRI with me lying on my stomach, which was impossible. The pain was excruciating. They tried different pillows and things, and for me to move my neck, it was impossible. And then and that lasted for maybe 2 minutes. I couldn't even last that long. And then when I went to stand up, I almost passed out from just disorientation and dizziness, and just the strange feeling that I had in my head from that. And then so just continued on with physical therapy and continued on with tests and CTs and more MRIs. And some of the doctors wanted to do very serious spinal surgery and thoracic outlet surgery with removal of the first rib. And in the testing, I was just below the point where you might need surgery. So I thought I could try to keep improving just with physical therapy and keep searching to find somebody who would treat the whole body, because everybody was just treating one body part at a time. So then that's when I found Jerry on the internet and watched many of his videos, and said that's what I've been searching for. And no one looked at my clavicle. No one. I went to many shoulder surgeons, and they were just dealing with my shoulder and not this part of the inner part of my clavicle. So finally got out to see Jerry, and it's hard. It's a hard drive if you're in pain, but I said this is the last person I'm going to go to before, if I ever even have to have any surgery. This is the last person I'm going to go to. So we came out, and within the first meeting, Jerry worked on my shoulders and that clavicle. And with the first thing that he did, I felt, and lying on my stomach, I felt immediate relaxation and relief. And it was something that every doctor kept telling me, and physical therapist told me to put my shoulders back. Well, it was always really painful for me to do that. And Jerry said, it's not really something you can do on your own. I'll continue to do that therapy at home. And then I think you worked on my the right leg and that hip that first day. And so I felt some relief with that. My problem is that I had been doing it wrong. I had been doing something similar, but I was doing it on the left side.
Okay, all right.
So, basically, Jerry just knows how to, he knows the movement of how your body is supposed to move, and where things are not moving and are stuck, and how to try to use therapy to get things unstuck and moving in the right way. And so that was just that little extra thing that I needed at the end to try to get even better, and try to especially fix this clavicle, because I knew there was something very wrong there, and it just really has limited my arm movement and movement of my neck, really, basically. So and then within the second visit, he worked on more areas of the body, told me exercises to do, and just really, I couldn't, this is the first time since I think I fell off the ladder that I've had relaxation in my shoulders and my clavicle. And I haven't had pain, tremendous
So about 3 years.
Yeah, 3
And
years.
I had you lay on your stomach today.
And I laid on my stomach without any pain, without my fingers going numb, no dizziness then when I got up.
How long did you lay?
Oh, several minutes.
Yeah, 3 minutes.
Yeah.
Very good. And you know what to do now.
And I know what to do. And on the third,
so you don't have to drive back here.
And the third visit, it was 12 hours to drive out here. And on the third visit, then Jerry showed me how all the things that I need to do back home, and or if somebody needs to help me, like my husband or maybe my physical therapist. And we got all of that on video. So
and they're quite simple, right?
And they're very simple.
Yeah.
And I did watch your videos on the neck videos with the movements, which I had done a little bit of that before, but I don't think I was holding my head correctly and my neck correctly. So, and they're all really simple, gentle movements. I had physical therapists turning my neck and just in horrific pain, and things that physical therapists did to my shoulder blades that I can't, looking back, I can't believe that they did those things that just created more pain for me. And so this was very gentle, very relaxing. Normally when I get out of bed in the morning, I'm in pain in my shoulders, and I didn't even have to worry about it at all the past 2 days.
Very good.
So, yeah.
Anything else?
No, come see Jerry.
Yeah, it's a very interesting case. I mean, I found that your AC joint seemed, distinctly hypermobile.
Yeah.
And I was concerned, will I or will I not be able to help it? And that is what is called a positional laxity. So when you approximate two bones that make a joint, the ligaments naturally relax. And that clavicle was positioned, the lateral part of it was posterior and lateral. Mm-hmm. I mean, the whole clavicle was. Mm-hmm. And so I restored those two movements. Mm-hmm. And it is almost normal today when I do the ligamentous stress tests. Mm-hmm. So it makes me very optimistic.
Yeah. Oh, the first day I was already happy that I came out.
Nice.
Very happy, yeah.
Well, great. Yeah. Thanks so much.
Thank you.